Schizophrenia. When you hear that word, what normally comes to mind? For most people, they think people with schizophrenia have multiple personalities. However, schizophrenia is not a split personality disorder. This myth may have come about because the word schizophrenia comes from Greek words that mean split mind. Another misconception about people with schizophrenia is that they are dangerous or violent. Studies indicate that people receiving treatment are no more dangerous than the rest of the population. Also, people may think that people with schizophrenia can't lead productive lives. However, with effective use of treatment available, living productive lives is possible for people with schizophrenia. After hearing the truth rather than the myth, did your thoughts about schizophrenia or mental illness change? Glenn Close once said, "It is an odd paradox that a society which can now speak openly and unabashedly about topics that were once unspeakable still remain largely silent when it comes to mental illness."
What is the definition of schizophrenia? According to Barlow, schizophrenia is a complex syndrome that inevitably has a devastating effect on the lives of the person affected and on family members. This disorder can disrupt a person's perception, thought, speech, and movement, almost every aspect of daily functioning. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, to meet the criteria for diagnosis of schizophrenia, the patient must have experienced at least 2 of the following symptoms: 1. Delusions, 2. Hallucinations, 3. Disorganized speech, 4. Disorganized or catatonic behavior, 5. Negative symptoms. At least one of the symptoms must be the presence of delusions, hallucinations, or disorganized speech. Continuous signs of the disturbance must be persistent for at least 6 months, during which the patient must experience at least 1 month of active symptoms or less if successfully treated, with social or occupational deterioration problems occurring over a significant amount of time. These problems must not be attributable to another condition.
Other types of schizophrenia are paranoid schizophrenia. It is regarded as one of the most common types of schizophrenia. Among individuals with the paranoid type, they commonly experience delusions and hallucinations in the form of voices. Key symptoms are delusions, hallucinations, and paranoia. DSM-5 diagnoses are a preoccupation with 1 or more delusions or frequent auditory hallucinations, and none of the following is prominent: disorganized speech, disorganized or catatonic behavior, or flat or inappropriate affect. Disorganized schizophrenia. The key symptoms are disorganized behavior, disorganized speech, disorganized thinking, and odd or bizarre behavior. DSM criteria are all of the following are prominent: disorganized speech, disorganized behavior, and flat or inappropriate affect. And the criteria are not met for catatonic type. Catatonic schizophrenia involves motor disturbances, disturbances in movement, and catatonia. Usually individuals with this subtype will experience a major reduction in overall activity to the point where they stop moving and may appear frozen. Key symptoms are catatonic stupor, echolalia and/or echopraxia, excessive motor activity, immobility, and negativism. DSM criteria are 1. Motoric immobility as evidenced by cataplexy, excessive motor activity, extreme negativism or mutism, peculiarities of voluntary movement as evidenced by posturing, stereotype movements, prominent mannerisms or prominent grimacing, and echolalia or echopraxia. Undifferentiated schizophrenia is diagnosed when individuals exhibit general symptoms of schizophrenia, but they don't meet specific diagnostic criteria for another subtype. Key symptoms are general schizophrenia symptoms, mixed symptoms, and nonspecific symptoms. The DSM criteria is a type of schizophrenia in which symptoms that meet criterion A are present, but the criteria are not met for the paranoid, disorganized, or catatonic type.
Schizophreniform disorder. Some people experience the symptoms of schizophrenia for a few months only. They can usually resume normal lives. For DSM-5 criteria, 2 or more of the following, each present for a significant portion of time during a 1 month period or less, if successfully treated. At least one of these must be 1, 2, or 3. 1. Delusions. 2. Hallucinations. 3. Disorganized speech. 4. Grossly disorganized or catatonic behavior. 5. Negative symptoms. An episode of the disorder lasts at least 1 month but less than 6 months. Schizoaffective disorder and depressive or bipolar disorder with psychotic features have been ruled out. The disturbance is not attributable to the psychological effects of a substance, drug abuse, a medication, or another medical condition. Schizoaffective disorder. Historically, people who had symptoms of schizophrenia and who exhibited the characteristics of mood disorders were lumped in the category of schizophrenia. Now, however, this mixed bag of problems is diagnosed as schizoaffective disorder. DSM-5 disorder criteria summary. A. An interrupted period of illness during which there is a major mood episode, major depressive or manic, concurrent with criterion A of schizophrenia. B. Delusions or hallucinations for 2 or more weeks in the absence of a major mood episode during the lifetime duration of the illness. C. Symptoms that meet criteria for a major mood episode are present for the majority of the total duration of the active and residual portions of the illness. D. The disturbance is not attributable to the effects of a substance or another medical condition. The major feature of delusional disorder is a persistent belief that is contrary to reality in the absence of other characteristics of schizophrenia. DSM-5 criteria. A. The presence of 1 or more delusions with a duration of 1 month or longer. B. Criteria A for schizophrenia has never been met. C. Apart from the impact of the delusions or its ramifications, functioning is not markedly impaired and behavior is not obviously bizarre or odd. D. If manic or major depressive episodes have occurred, these have been brief relative to the duration of the delusional periods. E. The disturbance is not attributable to the psychological effects of a substance or another medical condition and is not better explained by another mental disorder. Attenuated psychosis syndrome. A diagnosis under study that would be given to a person who is beginning to experience 1 or more of the symptoms of schizophrenia, such as hallucinations or delusions, but is aware that these are unusual experiences.
Here are some statistics to keep in mind about schizophrenia. Schizophrenia affects approximately 2.4 million adult Americans and affects 21 million people worldwide. According to Barlow, the lifetime prevalence rate of schizophrenia is roughly equivalent for men and women, and it is estimated to be 0.2% to 1.5% in the general population, meaning the disorder will affect about 1% of the population at some point. Symptoms of schizophrenia are categorized into 2 types, positive and negative.
Positive symptoms are more obvious signs of psychosis. Hallucination is defined as a psychotic symptom of perceptual disturbance in which something is seen, heard, or otherwise sensed, although it is not actually present. Delusions are psychotic symptoms involving disorder of thought, content, and presence of strong beliefs that are misrepresentations of reality.
In contrast to the positive symptoms of schizophrenia, the negative symptoms usually indicate the absence or insufficiency of normal behavior. This includes avolition, an inability to initiate or persist in important activities, also known as apathy. Alogia, a deficiency in the amount or content of speech, a disturbance often seen in people with schizophrenia. Anhedonia, an inability to experience pleasure, associated with some mood and schizophrenic disorders. And flat affect, an apparently emotionless demeanor, including toneless speech and vacant gaze, when a reaction would be expected. And it won't leave.
potential causes for schizophrenia are genetic influences. This has been measured through twin and family studies.
Neurobiological causes can be deficiency in the stimulation of prefrontal dopamine receptors and the alterations in prefrontal activity involving glutamate transmission. According to Barlow, it appears that several brain sites are implicated in the cognitive dysfunction observed among people with schizophrenia. People with schizophrenia have been shown to have abnormally large lateral and third ventricles in the brain. And also, people with schizophrenia have hyperfrontality, which is too much activity, indicating that dysfunction is reliable.
Another influence that can cause schizophrenia is fetal exposure to viral infection, pregnancy complications, and delivery complications, prenatal exposure to influenza, and pregnancy complications and delivery complications.
This type of environmental stress may trigger the expression of the disorder of schizophrenia. Aside from genetic, neurobiological, and prenatal influences, outside influences also can trigger schizophrenia. A potential onset for schizophrenia is chronic and early use of marijuana.
Stress is a psychological and social influence. It is important to learn how much and what kind of stress makes a person with a predisposition for schizophrenia develop the disorder.
Family interactions can contribute not to the onset of schizophrenia, but to the relapse after initial symptoms are observed.
Treatment options for schizophrenia include biological interventions, antipsychotic medications, and psychosocial interventions.
An example of biological interventions is electroconvulsive therapy, which is used in combination with antipsychotic medications.
One group of antipsychotic medication is the first-generation antipsychotics known as neuroleptics, which reduce hallucinations, delusions, and agitation. There are second-generation antipsychotics such as risperidone and olanzapine. Second-generation medications are more commonly used in the treatment of schizophrenia today.
Despite the effectiveness of antipsychotics, they work only when they are taken properly, and many people with schizophrenia do not routinely take their medications. Some examples of psychosocial interventions are client role play, where the person who has schizophrenia can learn social skills. Also, behavioral family therapy to help educate the family on the different treatment options for schizophrenia.
If you or someone you know has schizophrenia and are trying to seek treatment or answers to questions you may have about schizophrenia, here are some resources that can be utilized.
Bryland Behavioral Health Systems, located at 1263 Delaware Avenue, Buffalo, New York 14209, offers group and individual counseling and also electroconvulsive therapy. Horizon Health Services, located at 3045 Southwestern Boulevard, Orchard Park, New York, offers private counseling. Dent Neurological Institute, located at 200 Sterling Drive, Orchard Park, New York 14127, is used to help diagnose schizophrenia and find treatment options. National Alliance on Mental Illness, or NAMI, can be located at NAMI.org or 800-950-6264, and it offers treatment options and support methods. Compeer Inc., located at 1600 South Avenue, Suite 230 in Rochester, New York, offers a support system for those who have schizophrenia.
The most effective way of treating and living with schizophrenia is a combination of medicine, counseling, and a support system. The resources stated offer these three effective tools in the treatment of schizophrenia. References used are the DSM-5 and the Essentials of Abnormal Psychology 7th edition by Duran and Barlow.
This PSA was brought to you by Alicia Reynolds and Amy Teig. Thank you.